Good morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery. My name is Dr. Stanley Aruyaru. Last time we spoke about the setup of a surgical service, and as promised, this episode talks about the composition of the surgical team. Team is the key word because if there is any discipline of medicine that exemplifies teamwork, it is surgery. So come on and let's talk about the composition of the surgical team. First member is the surgeon. The surgeon is the technical expert and the overall team lead in whichever operation. He takes responsibility of everything that happens to the patient. Then we have the anesthetist or the anesthesia provider. Depending on their qualification, the names are different. Anesthesiologist, anesthetist, you name it. But the sole purpose of the anesthesia provider is to put the patient to sleep or to numb a segment of their bodies that needs surgery. And their interaction with the patient starts before surgery, continues during surgery, and afterwards. Then we have the category of the assistant surgeon. The assistant surgeon can be occupied by different cadre depending on demand and supply. But this could be another surgeon who is assisting the surgeon in a major operation. It could be a surgeon in training, call him registrar or resident. It could be a medical officer or medical officer intern who is assigned to the surgical unit. These assist the surgeon in the operation. Sometimes you have several assistants, especially if the operation is complex. Sometimes you even have several teams operating on the same patient. The essence is to have a lead surgeon and assistant or assistant surgeons. Then from the nursing cadre, we have two important key players. One is the scrub nurse. The work of the scrub nurse is to set up the instruments on the operating table and hand them over to the surgeon as they need. Now, operations utilize numerous array of instruments. And a surgeon who is busy focusing on the operating field doesn't have the time to reach out to pick these instruments. So the scrub nurse has to hand over these instruments to the surgeon. Under the same nursing cadre is the next role player in the team, and that is the circulating nurse, also known as the runner nurse. Now in surgery, once we scrub, which is to clean our hands in a certain way, and then we don on the sterile attire, we cannot touch anything outside that specified sterile field. Which means if the surgeon needs a certain suture which is not already opened and on the table, the surgeon or the scrub nurse cannot touch the unsterile boxes or packets. They need to send someone. And that is where the runner nurse comes in. They open sutures, they open sets of equipment or sets of clothes when we need them and we don't have them on the table. So they are our communication with outside the operating room, the runner nurse. Sometimes I call them runaway nurse because they disappear outside and I'm kept shouting, calling for someone to come in. Then we finally have the theater technician. Now the theater technician is someone trained in theater, and often they double up with the role of the theater nurse or the scrub nurse. They are trained on how to scrub, they are trained on how to set up different instruments, and even on how to assist surgeons in operations. The difference between the nurse and the theater technician is that the nurse is already qualified as a nurse and they can easily be deployed to the recovery room, to the emergency room, etc. because they are nurses first. But the theater technician can only operate within the theater setup. Team lead, surgeon, anesthesia provider, surgical assistant, runner and scrub nurse, and theater technician. These are the members of any surgical team. Thank you for watching.